Hello, good evening. Why don't you start the weekend off by knowing your mental status? Health is the only wealth you can pride in. A very good evening. This is Doctors on Call. My name is George Oraro. Welcome to this evening's show. I'm here with a lady and a gentleman. I'll be introducing them to you in a short while. Have you visited our blog this evening? I'm looking at it right now. There's questions which you can ask on the blog. There are health tips, and there's a segment telling you the guests that we are hosting this particular evening. It's familymediaonline.com/docblog. As stated earlier on, I have the pleasure of hosting Dr. Mutisia. She is a psychiatrist, together with Dr. Geoffrey Magada. He is a physician. So you can get to ask either of the doctors the medical questions that you might be having with you. Our SMS line remains the same. It's 22316. Alternatively, you can give us a call through the number 0204 200 000. Now, to know our doctors briefly, in as much as you've seen them on the show before, I'll start with you, Dr. Mutisia. Good evening.
Good evening.
Thank you for coming on to the show.
Thank you.
In your specialty as a psychiatrist, what does that entail, briefly?
Yeah, psychiatry is a branch of medicine which deals with the prevention and treatment of mental disorders. And there are quite many, ranging from the commonest anxiety disorders, depression, severe ones like bipolar mood disorder, like schizophrenia. We also have childhood disorders like ADHD, what we call attention deficit hyperactivity disorder, adolescent issues, and then also for the geriatrics, where we have cases like dementia, Alzheimer's. We also have medical conditions causing psychiatric disorder, so it's a wide range.
And I think when it comes to adolescent, we have to talk briefly about that, but we'll do so as we go on with the show. And the gentleman I was talking about earlier is Dr. Geoffrey Magada. Good evening, Dr.
Yeah, good evening.
Thank you for accepting our invitation once more.
Thank you for the invitation. Yes, I'm glad to be here, actually.
Okay, as for the introduction.
Yes, consultant physician. We deal mainly with, conditions that medical conditions that affect adults. To a small extent, we interface with psychiatry as well. So hypertension, diabetes, infectious diseases, and all the other non-communicable diseases, cancer, all those fall under our jurisdiction.
Speaking about hypertension, I'm going to throw a question right about now. I'm not going to give you room to rest.
Yes.
I've just received a question from Josephine, and it goes: a friend of mine is hypertensive since 2003 and is being seen with a physician. He has a low libido case which just started a few months ago. He's on treatment. My question is, what could be the cause of low libido? I thought only diabetic patients are the ones who can develop such a problem. That's a question from Josephine.
There are many causes of low libido. Some of them are mental, and we shall be told about that. But yes, diabetes is one of the biggest contributor to low libido in our medical patients. But even hypertensives, and that can be because of the drugs. Some of the drugs that we give for hypertension can cause low libido. It could also be just the disease itself. Sometimes when you get the blood vessels affected, then the libido will go down.
Okay. Just a reminder, this evening you can get to join in on the conversation by sending an SMS to our line, which is 22316. Remember, we're coming to you live on Family TV and Family Radio 316 as well. Remember, you can still call us on 020-4200-000. Now that I have a laptop this particular evening, you can still post on our blog, and I'll read it as we proceed on with the show. There's a question that came in earlier before the show, Dr. Mutisia, and it goes: how do you deal with someone who is in denial about mental illness and refuses to take medication and is completely unproductive and a burden to the family?
Okay. One unique thing with mental disorders is that unlike physical illnesses where you would feel pain or you would see a swelling or you would feel physically weak, with mental disorders, you may not have those symptoms. And so this person will say, why are you saying I'm sick and yet I'm not feeling any pain, I'm looking healthy? And we call that lack of insight. Most of the psychiatric disorders, the sufferers have no insight. They do not understand they're unwell. They might think that they are behaving normally. And even for the severe cases, if you're hearing voices, you might think, I mean, you're hearing, it's a reality to you as much as other people might not hear. The mild ones, like mild depression, you might know because you will feel, I'm sad, I don't feel like getting up, I don't feel like enjoying the things I used to enjoy. So the mild ones, you might be able to know. And so when somebody has a severe illness, mental illness, and they don't realize, it's upon the family members, the friends, to actually find a way of seeking help for them. And sometimes, most of the time, they are actually taken to hospital against their wish, because you can't watch them suffer when actually you know they are unwell.
Okay.
Yes.
And the bit about being a burden to the family, they're definitely not a burden. I think
they are not a burden. They just need help. So even if you're taking them to hospital against their wish, you're doing the right thing. And if they are taken to hospital, they'll be sorted out.
Okay.
Yes.
There you have it. A question, it's anonymous though. Hi, what's the main treatment of chronic tonsillitis in adults apart from antibiotics, Dr. Magada?
I think one may need to establish why the tonsillitis. Most causes of tonsillitis are infective. And so when somebody has had a sore throat for a long time and it's diagnosed as tonsillitis, and if it's associated with fever, most likely it's an infective cause, and it would need adequate antibiotic cover. Some people have recurrent sore throats because the treatment that they are receiving is not adequate. However, there are certain other causes of tonsillitis that are non-infective. For example, people who have a tendency to allergy, they will tend to have these recurrent sore throats. And if it is not handled at that level of allergy, sometimes it recurs or persists over a long period of time. Some might require surgery to sort of interrupt the recurrence of the same.
And there seems to be a confusion between tonsillitis, which commonly people refer to it as tonsils, and sore throat.
There is sore throat. The throat has tonsils, but it has something we call the pharynx as well. And tonsils are the swellings, that the lymphoid tissue in the throat that to a large extent is helpful in conferring immunity to the individual. But in situations of infection, it swells. And it may swell, and of course, once infected, it may cause pain and painful swallowing. And of course, feeling sore in the throat, yes.
Okay, thank you for that clarification, Dr. Magada. There is a question I've just received, Dr. Mutisia. Hello, Doctors on Call. I'm a girl in early 20s, but I think about sex a lot. I masturbate a lot. I think I'm going crazy. How can you help such a patient, Dr. Mutisia?
Yeah, thank you for that question. We find that young people, as they pass through the stage of adolescence to adulthood, some of them will experiment with masturbation at one point, but then they need to be aware that if it becomes an addiction, where you feel that you are not able to, it will even interfere with your schoolwork or even with your work if you're employed, then it actually becomes a serious problem, and it can actually affect your later marriage life, where you find, because you are addicted to masturbation, probably you will not be able to satisfy your partner, and so it would be very good to not start the practice in the first place. And if you realize you're in it, it would be good to actually stop it, and if you're not able to, you can seek help to be assisted to stop it. Yeah.
I think just to add on that, the young people have to be careful what they watch, what they read, because that is what informs their mind. And if you get exposed too much to things, sex, then of course your mind will think a lot sex.
It all starts with the mind, mindset. We have an anonymous sender asking us to talk about OCD and its treatment. That's the question.
Yeah. OCD is obsessive compulsive disorder. And this is one of the anxieties where somebody could be obsessed, like, for example, fear of disease and fear of germs, and they keep washing their hands. And they believe that they will get an infection. We've had even prominent people who have to wear gloves and when they're shaking hands because they are scared they might get germs. So this is a disorder which can actually be debilitating and stop you from enjoying relationships and also from working. It can be treated. The management starts with the correct diagnosis and then the correct treatment.
Okay.
Yes.
So there's hope for somebody suffering from this OCD.
Yes.
Okay, you're not willing to share the treatment on here?
The treatment. Yeah, the treatment will involve both the medication and also some psychotherapy, behavioral therapy. Yeah.
Okay.
Yeah.
In case you're joining us, this is Doctors on Call. My name is George Oraro. I have the pleasure of hosting Dr. Geoffrey Magada. He is a physician together with Dr. Mutisia. She is a psychiatrist. Remember to send in your questions to our SMS line, which is 22316. You can still call as early as right now. Our phone line is 0204200000. Epilepsy seems to be a common disorder, but there is hope in terms of treatment. In medical technology today, we have a look at that. We'll be right back after that.
In our medical technology today, hope for epilepsy patients, as a new generation of implantable closed-loop devices are designed to monitor seizures and detect patterns of electrical activity that indicate a seizure is beginning. Epilepsy affects more than 5% of the world's population, and more than half of patients can achieve seizure control with treatment. But almost a third of people with epilepsy have a refractory form of the disease. Because epilepsy causes repeated sudden seizures, people with this condition can benefit greatly from a therapy that can detect seizures just as they are starting or eventually predict them before they begin and prevent them from happening. A new generation of implantable devices is looking to pick up where medications often leave off. The closed-loop device is designed to monitor the seizure focus, detect patterns of electrical activity that indicate a seizure is beginning, and quickly respond without external intervention. The device is surgically placed in a section of the skull and can be accessed via outpatient surgery when the battery has to be changed. It is invisible to the patient and others. The implant, which is now seeking FDA approval, also records information on electrical activity in the brain throughout the day for later review. The RNS has a laptop-based wand interface for remote patient monitoring.
Welcome back to the show. I still have Dr. Magada and Dr. Mutisia here with me. Our SMS line still remains the same. You can send them, you can still continue sending them to our line 22316. I've just received one. It's anonymous though. What can really cause swelling legs? And when I sit, it's painful. When I walk, I also have neck pain, which reoccurs. Please help, because if I go for medication, they just test for malaria, which has never been found. Dr. Magada.
Swollen legs can mean a problem with some of the major organs, like the heart, the liver, the kidney. Swollen legs can also just occur because either somebody stands for too long, and so fluid then gravitates in the legs, in the feet. Swollen legs can occur because the veins are incompetent. Veins are supposed to return blood to the heart, and sometimes they're incompetent. They're not able to get the blood back, and so blood gravitates, and some of the fluid then leaves the blood vessels into the tissues and causes swelling. Swelling can also occur because there is obstruction to the veins as well, for especially pregnant women or people who have masses, swellings inside the pelvis. That can lead to, so there are many causes of leg swelling. But the commonest, which I think the caller is describing, is lymphedema, and that sometimes can cause pain. And it is important that she goes for checkup, especially to rule out clots in the legs, because sometimes clots in the veins can also cause leg swelling, and that can be painful. And the danger with clots in the veins, in the legs, is that those clots can get into the chest and cause a difficult problem, what we call pulmonary embolism. And sometimes people have died from that kind of a situation. So it's good that it be checked. And if we find there are no clots, then it can be treated as lymphedema, and there are drugs that she can get to reduce the pain and reduce the swelling.
Okay, thank you for that response, Dr. Magada. There's a question I've just received. I'll read to Dr. Mtisia. Hi, my brother was diagnosed with dyslexia, although he has mild mental retardation. On top of that, he suffered mental delusions, which were diagnosed as affective disorder bordering on schizophrenia. And is it possible to have so many diverse conditions at once? That's the question from our center.
Yes, it's possible to have so many conditions together because the writer for the question says that the child was born with mental retardation, and sometimes the causes of the mental retardation could also be accompanied by other disorders. Dyslexia is inability to read and write, or problems with reading and writing, which commonly is diagnosed in children when they are young, when they're in primary school. It can be worked on through remedial classes. Yes, but then the mental retardation, we assess and see the severity. If it's mild, the person can still be able to live up to adulthood and be able to enjoy life, to be able to learn skills they are able to learn. Sometimes when it's severe, then you teach the person activities of daily life that they are able to take care of themselves. So the most important thing would be to actually diagnose the cause of mental retardation. Then it can point towards what else could be happening in the brain.
Okay.
Yes.
There you have your answer. I've got a question from Lois. I'll read it to you, Dr. Magada. Was diagnosed with H. pylori antigen. Does it mean I already have ulcers? I'm under treatment. ASO kit and SOS SIP. Was told to avoid acidic foods and spices. What's your response, Dr. Magada?
Yeah, thank you for that question. H. pylori is a bacteria that tends to increase acid production. And this can lead to ulcers, but not everyone who has H. pylori has ulcers. And so many people, in fact, over 90% of the population actually have H. pylori, and they do not necessarily have, not all of them have symptoms. So not everyone who has H. pylori has ulcers, but if they develop symptoms, then obviously eradication therapy and ESO kit is one of those kits that are used in eradication therapy. It's given to try and reduce the population of H. pylori. H. pylori itself has been associated with other complications apart from just ulceration. You know, too much acid gives you hyperacidity, and which makes a lot of noise in the tummy, and that makes people uncomfortable. It affects them mentally, and many of them, of course, will end up seeing the psychiatrist as well.